Good evening, everybody. Welcome to today's episode on Dr.DWIBHASHI Acupuncture Education Series. Trigger finger. So, what is trigger finger? We will explain in detail. Understand what before going to it, we must see the learning objectives. Understand trigger finger anatomy, symptoms, diagnosis, and maintenance. Definition: trigger finger is caused by an impaired gliding of flexor tendon through a sheet leading to clicking or locking. So, number one is the flexor tendons allows the fingers to bend. Number two is the tendon sheets. These are the tendon sheets. A protective tendon that surrounds the tendon. Number three, that is the A1 pulley. This is called as pulley. First annular pulley located at the base of the fingers. Thickening here can cause triggering. This is the way where triggering occurs. Number four, that is flexor retinaculum. Flexor retinaculum is the strong ligament that holds the tendon in place at the wrist. So this is the distal phalanx, this is the middle phalanx, this is the proximal phalanx, this is the metacarpal bones, flexor tendon, transverse carpal ligament, carpal bones. Relevant anatomy, flexor tendon, tendon sheet, even fully finger joints. So I have already explained each and everything, but once again, so bones of the hand, there are 8 carpals, 5 metacarpals, and 14 phalanges. This is the anterior palmar view, dorsal nerves, distal arteries, flexor digitorum, profundus tendons, flexor digitorum, superciliary tendon, lumbar muscles, thenar muscles, which are used for the movement after pollicis brevis and flexor pollicis brevis, opponens pollicis. And this is the proper palmar distal nerves, common palmar distal nerves, palmar metacarpal arteries, hypothenar muscles, and the movements which are caused by these muscles, that is abductor digiti minimi and flexor digiti minimi, opponens digiti minimi. And here is the nerve, that is the ulnar nerve, supplying the thumb, and the median nerve, where you can see the supply, and there is ulnar artery is there. Here the extensor tendons, dorsal metacarpal arteries, extensor retinaculum is there. So these are the cross sections. These are the muscles already I have explained, and these are the nerves. So this, and here another view is that this is the dorsal view, this is the palmar view, and focus on A1 pulley, site of trigger finger. This is important. Here the bone is normal, the A1 pulley is normal. Flexor tendon glides smoothly. So here it glides very smoothly. Tendon sheet is there. But whereas in trigger finger, you can see the difference. The A1 pulley is thickened. This is thickened. And because of this, the tendon, the flexor tendon is swollen. Thickening of the A1 pulley or swelling of the tendon cannot glide smoothly, cannot glide because it is thickened. Finger clicks, catches, or locks during movement. So movement of the fingers, finger extended, finger flexing, finger fully bent. Major muscles, thenar muscles, hypothenar muscles, and interosseous muscles. These are for the fine finger movements. And here is the nerve supply. This is the ulnar nerve supply, which supplies the little finger and half of the ring finger. Rest of the fingers is supplied by the median nerve, thumb, index, middle, and half of the ring finger. And the blood vessels, here is the blood supply, superficial palmar arch, and this is the common distal arteries. Risk factors: repetitive gripping, diabetes, middle age, and inflammatory disorders. Symptoms: clicking, locking, pain at finger base, morning stiffness, reduced gripping. Open hand, finger in normal, in open position. Bend the finger. So when you're bending the finger, slowly bend the affected finger towards the palm. Finger locks, finger gets stuck. in bent position and cannot straighten. It cannot be straightened. Straightening attempt. Use the other hand or gently force to straighten the locked finger. What you may feel or hear: a catching or locking sensation during bending, pain or tenderness at the base of the finger, a click or snap when finger suddenly releases. When sudden releases, there is a click. Finger suddenly releases with a click or snap and moves into normal position. This demonstration shows a typical pattern seen in trigger finger. Consult a qualified healthcare professional for proper diagnosis and treatment. That is important. Examination: observe locking tenderness over even pulley and finger movement. Diagnosis: usually clinical imaging when indicated to exclude other pathology. Management: activity modification, splinting exercises, medication when appropriate. Role of acupuncture may be considered for selected patients as a part of comprehensive treatment plan. Exercises: gentle tendon gliding exercises under guidance. These are the tendon gliding exercises for healthy and flexible fingers. Perform each position slowly. Hold for 5 seconds. Repeat 5 to 10 times, 2 to 3 times daily. Straight hand: start with fingers straight and relaxed. Hook first. Bend the middle and end joints while keeping knuckles straight. Full fist. Make a full fist by bending all the joints. Tabletop. Bend the knuckles, that is the MCP joints, while keeping the fingers straight. Straight fist. Bend the knuckles and middle joints, leaving the end joint straight. Thumb touch. Touch the tip of each finger or the tip of the thumb. So you can see the reason why these exercises, the guided tendons, are in extended position. Tendons glide at the middle and end joints. Tendons glide fully into the palm. Tendon glides at the knuckles, that is the MCP joint. Tendon glide at the knuckles or and middle joints. Full tendon movements and coordination. What are the benefits of these tendon gliding exercises? Improves tendon mobility and flexibility, reduces stiffness and finger tightness, helps in recovery from hand injuries, prevents adhesions and scar tissue, improves hand function and grip. The guidelines are: move slowly and smoothly. That is important. Do not force or cause pain. Stop if you feel sharp pain. Best done warm after a warm soak or gentle heat. Stay consistent for better results. That is important. Without consistency, we can't see the results. So already this has been explained. And tip: regular practice of these exercises keeps your tendons healthy and your fingers moving freely. Prevention: ergonomics, regular breaks, manage medical conditions, myths: not only an age-related condition, several risk factors contribute. Key takeaways: early assessment and appropriate management can improve function. Thank you. Please subscribe to my channel, that is Dr.DWIBHASHI Acupuncture, for updated acupuncture educational videos. Thank you very much. We will see you on Monday.